So this is post MI left ventricular pseudoaneurysm closed with ASD device. This is one of the rare case where we have usually indicated is surgical closure by the surgeons, by opening the heart. But this time we have closed with the device. So this 56-year-old male having old inferior wall myocardial infarction in 2010. He underwent PTCA and stent of RCA and LAD. He developed dyspnea class 2 with angina class 2. Clinical examination showed systolic murmur at third left intercostal space and at apex. So echo showed large pseudoaneurysm of the LV on the lateral wall near the mitral valve, compressing the left atrium. CAG showed LAD before stent 90% stenosis. So sent to CTVS surgeon for CABG and closure of LV pseudoaneurysm. Cardiac surgeon opened the chest, put graft, but could not able to close the pseudoaneurysm due to lot of adhesion. They were afraid of opening the adhesion and causing the bleeding from the LV. So surgeon closed it and referred back to us for device closure. So this is the pseudoaneurysm. It will be seen better. This is RAO view. This is best seen in the LAO cranial view. Filling on the posteriorly, there's a huge pseudoaneurysm around 7 centimeter wide and 10 centimeter length, more than 10 centimeter length, and there is a hole in the posterior wall of the lateral wall of the LV. So what we did, we crossed with the right coronary artery and thermo wire into that pseudoaneurysm through retrogradely, and then exchanged it with the made a loop, Cook extra stiff wire, and made a loop inside the pseudoaneurysm, and then put 10 French delivery sheet, ASD delivery sheet from Amplarger, that is torque view sheet, across the pseudoaneurysm, inside the pseudoaneurysm, and then took 26 millimeter ASD device from LifeTac. First deployed the aneurysmal part, the distal disc, and then checked in the echo that it is closing, it is near, and then release the right this LV disc on the disc on the LV side, true LV side, and then checked with the LV angio that it's closed. And then there is a problem that whether the LV umbrella is impinging on the chordae of the mitral valve and causing some MR or not. So we checked in the echo, there was eccentric MR and left atrium is already closed. We'll show you after that. So this is angio in the RAO view, no flow into the pseudoaneurysm anymore. So we put your catheter, that is Swan-Ganz catheter, into the pulmonary artery to know the pulmonary capillary wedge pressure. And what we found, the pulmonary capillary wedge pressure was below 20. And so we released the device and then checked by the echo and everything. The flow through the pseudoaneurysm was closed without any complications. And then we checked in the, and we closed the femoral artery by using per closed device. Here, this is the echo. This is the LA, which is almost compressed. And this is the device. And mitral valve flow is okay. It was not any problem. And this is the device here. And this is the whole pseudoaneurysm compressing on the LA. This is another, this is pseudoaneurysm, and this is the device. This is the LV side. There is no significant, this is the mitral regurgitation flow, which is mild and eccentric, post-eccentric. Yeah. This is same echo showing the isolation. And yeah, this is the MR. You can see posteriorly directed MR. LA is already compressed, slit-like. But now the patient is doing fine. He's totally asymptomatic. He's having no symptoms and no any murmur on the chest. So this is the how we can close the pseudoaneurysm of the LV without surgery by device. Also, when the surgeons fail to close it. So this is summary and conclusion of my topic is post-MI development of pseudoaneurysm is a dreaded complication, leads cardiac sudden death due to contained rupture in the pericardium, leading to cardiac tamponade and death. Those pseudoaneurysms which are contained rupture chronically get fibrosis around and patients survive. These pseudoaneurysm needs to be closed by open heart surgery, but in our case, surgeon could not able to close due to severe adhesion, returned back to us for device closure. Therefore, we close this large pseudoaneurysm with device with complete exclusion without any major complication except mild eccentric MR with pulmonary capillary wedge pressure 21 millimeter of mercury, which later decreased to around 15 millimeter of mercury due to mild MR and LA compression by the pseudoaneurysm, which LA compression with progress of time will will go away and LA will expand again. Thank you.